Hello friends, welcome to PharmaGrid. So let's continue with the recalls discussion, beginning with question number 66. Tamoxifen does not act as agonist in which tissue? Okay, so the options are breast tissue, ovarian tissue, uterine tissue, bone tissue. So here the correct answer is option A, that is breast tissue. That is tamoxifen act as an estrogen antagonist. Okay, in the breast tissue. So it is used in the treatment of breast cancer. This tamoxifen is a selective estrogen receptor modulator. The selective estrogen receptor modulators are a class of estrogen-related compounds that display selective agonism or antagonism for estrogen receptors depending on the type of the tissue. Okay, so this category includes tamoxifen, raloxifene, besidoxifene, clomiphene and osmifene. In the endometrium, this tamoxifen acts as an estrogen agonist, so it has got the risk of endometrial cancer. So this tamoxifen binds to estrogen receptor and acts as an antagonist in breast tissue while acting as an agonist or partial agonist in the uterus, bone and heart. Next question. Gastric intrinsic factor is a glycoprotein that is required for the gastrointestinal absorption of. The options are medium chain triglycerides, folic acid, iron, cyanocobalamin. So here the correct answer is option D, that is cyanocobalamin. The cyanocobalamin, also known as vitamin B12, is essential for the proper growth, cell reproduction, formation of blood components and many other functions. In order for the cyanocobalamin to be absorbed properly from the gastrointestinal tract, it must combine with a glycoprotein called intrinsic factor. In the absence of proper levels of intrinsic factor, cyanocobalamin is administered parenterally or intranasally. Moving on to the next question. Reflex tachycardia is an adverse effect most likely to be associated with the use of which of the following drugs? The options are minoxidil, losartan, moxapril and nadolol. So here the correct answer is option A, that is minoxidil. So we know that this reflex tachycardia is commonly seen with the use of peripheral vasodilators such as minoxidil and hydralazine. This minoxidil is a peripheral vasodilator. What is losartan? Losartan is an ARB, that is angiotensin receptor blocker. The drop in blood pressure produced by the use of these agents causes increased renin secretion, heart rate and output as well as sodium and water retention. This may worsen both angina and congestive heart failure. These adverse effects observed with the use of peripheral vasodilators may be managed by the concurrent administration of a beta-adrenergic blocking agent and or a diuretic. So the point is that reflex tachycardia is commonly seen with the use of peripheral vasodilators such as minoxidil and hydralazine. So among these options, minoxidil is a peripheral vasodilator. Next question. A microorganism that is particularly dangerous to the eye is. The options are Streptococcus thermophilus, Bacillus subtilis, Pseudomonas aeruginosa, Aspergillus niger. So here the correct answer is option C, that is Pseudomonas aeruginosa. Penetration of the cornea by Pseudomonas aeruginosa will often lead to destruction of the cornea and interior portions of the eye. Blindness may result. This organism is a common contaminant in water. The need for sterility of ophthalmic products is well recognized. Okay, so the microorganism that is particularly dangerous to the eye is Pseudomonas aeruginosa. Okay, so question number 70. A common measure in assessing the degree of immunodeficiency in acquired immunodeficiency syndrome, that is AIDS patients, is the determination of the levels of. The options are CD4 cells. CD4 means cluster of differentiation. Then pneumocystis carni organisms, leukocytes, serotonin. Leukocytes are otherwise known as white blood cells. Serotonin is a neurotransmitter. So here the correct answer is option A, that is cluster of differentiation cells or CD4 cells. The CD4 cells are a type of T lymphocytes whose primary role is to stimulate other cells in the immune response. The lower the level of these cells in the patient's blood, the more susceptible the patient becomes to the development of opportunistic infections such as pneumocystis carni pneumonia. Okay, so with this question, we have completed today's recalls discussion. Thank you for watching this video. Let's see in the coming session.